Hi, I'm Tim Lewis with Multimedical English, and today we're going to talk about telehealth modules. So let's talk a little bit about how this actually works. All right, so I have just give you a little bit of background in my experience with telemedicine, telehealth. I worked as a paramedic in the early 70s, and we had one of the first call boxes that we could call and send an EKG directly to the hospital, where they had a receiving unit in the hospital, and we could actually monitor. They could actually see what we were seeing out in the field. And they were the very first ones that was available. And then we would transport the patients in. After that, I had experience in setting up the protocols for some hospitals. After I finished my medical training, I set up protocols for history taking and for protocols on what the paramedics needed to do in the field before they brought the patients in. And then we set up I was involved in a system where we had a telephone triage system, one of the first ones, where all the patients could call in and ask questions about what they should do with their child or anything, and where could they go. It was part of a health maintenance organization system where it was we would take care of those patients. There was about 500,000 patients that were in the program at the time. And so we would, if they called in and it was a 911 call, we would patch 911 and send an ambulance to that patient, and we would be asking the history. And then when the paramedics came, they could decide whether we were going to transport or not, and if the patient had to be moved to one of our hospitals. So that's the experience I have. We've done a lot, and I trained a lot of doctors since then in different types of telemedicine, until it's actually morphed into the systems that we have now. So I have the knowledge, experience, and understanding of how this works. So now that USMLE has adapted to telehealth system, well, that's what we've been doing also, not only training USMLE, but we've been doing telehealth for all along. So what can we do for you? Well, let's talk about the 3 modules that they have for testing. The first module is when you're just online with one person, and when it comes to the history will be the same, but when it comes to the physical exam, you don't do that, and then you do the closing and the counseling that you would do in a regular patient, and you would type up the patient note. But for the physical exam, they would ask you to type up the focused physical exam that's required for that patient. So what's the first step? Inspection, then auscultation, and percussion and palpation, and whatever special tests you would need for the abdomen at that time. So if that was an abdominal patient, right? So that would be the first module. And so you have to type up that. The second module that we train with is a module with a patient online, and you have to do the limited physical exam that is limited to that system. So if it's an abdominal exam, you would have the patient feel his ribs and feel down, and where would the pain be located in relationship to the quadrant. So you tell them, I'm going to draw a line through your belly button and a line right above your belly button, and these are 4 areas. Where is your pain? And can you press down on it? And does it hurt more when you press down or let go quickly? So you'll guide them through a couple of the tests that you can do, and you can't do percussion and auscultation, but at least you can do a couple things and get an idea, and we understand the anatomy of basically what's going on with the pain. Okay, so, and then of course the history taking, and in that module, history taking, counseling, closing is the same, and your documentation would be the same as USMLE. So that's the second module. The third module is where you have a nurse in the room, and there's a patient already there, and so you would be talking to the nurse and the patient, talking to the patient basically, but the nurse would be your hands. So the nurse would do the physical exam, but you have to guide the nurse in the proper order. So the nurse, you say, please, I'd like you to look at the stomach. Okay, I'd like you to listen to all 4 areas, 4 quadrants, and she'll do that. Please tell me your findings. And then she's going to percuss out the liver and the spleen. She knows how to do that. So she'll percuss that out and tell you if it's large or not. She also knows how to do the rebound test and obturator. So if you need it, she can do it. So you can order that. And if she doesn't, you need to explain to her how to do that test. so you should know, and Murphy's sign, right? So those would be the things that you would do in the room for that last patient. Then you would do the counseling and closing with the patient, and you would document your findings, just like in USMLE. So those are the three models that we do for testing in telehealth models. Let's see what USMLE does, but whenever you're ready, as you know, we have a lot of experience here to help you with that. And so I hope to hear from all of you. And if you'd like to come and see us, we're available every Saturday at 9 a.m. Just look down the link at the free classes. And the classes will be going into pay-per class. So the class will be free on Saturdays right now, but in the future, it might be just a small fee to get into those classes on Saturday, because it's a really nice class. We teach a lot of things. We answer all your questions for USMLE. And we also do cases. So that's going to be coming up soon. Thanks so much for joining us. It's such an honor to talk to all of you here. If you have any questions, contact us. Talk to you later.